Hello, everyone, and welcome to today's webinar in which we, along with some esteemed colleagues, will be introducing and discussing the Department of Health and Aged Care's National Consumer Engagement Strategy on Health and Wellbeing, which has been underway for a little while, and so they've released a draft. So let's start with an acknowledgement of country. I'd like to acknowledge the traditional custodians of the lands on which we are all living and working today, and their continuing connection to the land, water, and the seas. I am on the lands of the Ngambri and Ngunnawal peoples, and I pay my respect to their elders past, present, and yet to come. I also pay our respects to any First Nations people here with us today. I'd like to invite everyone to acknowledge the traditional custodians of the lands on which they're dialing in from. So just a bit of housekeeping. Today we've got three speakers presenting as part of the panel. We have Joe Root, the Policy Director here at CHF. We have Anthony Brown, the CEO at Health Consumers New South Wales, and Sophia Petrov, the National Manager of Policy Engagement at COTA Australia. All three of them will be presenting different takes on the strategy, and then we'll be having a panel discussion after that. The chat and Q&A are open, and so you're welcome to enter any questions that you may have into either of those channels, and we'll be asking them in the panel discussion towards the end. This webinar is being recorded and will be posted on our website after it's completed. So I'm going to stop screen sharing now, and I'll hand over to Joe.
Thank you, Daniel, and good afternoon, everybody. Thanks for making time to come along and talk about this. The National Consumer Engagement Strategy for Health and Wellbeing is part of the National Preventive Health Strategy. It's part of a suite of products, the other one being the National Health Literacy Strategy, which is still under creation. The idea being that we need to make more of a partnership of preventive health, that we need consumers and policymakers and consumers and decision makers all working together to achieve the goal. Really, the National Consumer Engagement Strategy is an acknowledgement that consumer engagement is important, but currently we're not particularly good at doing it. And there's a lot of CHF often has organizations asking us how to do it. How should I go about it? What should I do? How should I get the most out of the consumer engagement? So last year, Rosemary Calder from Mitchell Institute of Victoria University led this work in partnership with CHF and 89 Degrees East. And it was based on a literature review and then some extensive consumer consultations and workshops with community organizations, government agencies, and private organizations to find out about their relationship with health consumers. One of the main contributions that CHF did was to organize a set of community conversations, sometimes called kitchen table discussions, which are consumer-led discussions where consumers get together people from their own network and have a discussion about a key issue. And we had a number of consumers put up their hand to run consumer conversations to help inform this work. And when we did that, the community of conversation hosts were asked to gather what they think and feel about the way governments currently get community views about preventive health policies and programs, gather ideas on how government could do better. I'm sure that was the longest list of all. Everybody's always got a list of what can be done better, and learn from local avenues or groups governments could work with by getting a picture of the groups that everybody in their network was connecting with, why people join groups, what they get out of it, what they learn from each other, and the benefit they get from being part of those groups. And so those discussions were held in May last year, and the report back from those conversations provided a really rich source of ideas because it's all very well to take community organisations like Ask CHF what it thinks about something, or Ask COTA, or Ask Health Consumers New South Wales. But when you go out and talk to people actually in the community, if you like, some real grassroots conversations, you get quite a different idea of what might work, what could work, and what are some of the barriers to things working. So those community engagements strategy conversations inform the strategy. The basic tenet of the strategy, I think, is that it's about relationships. A lot of it is about building strong relationships and strengthening the partnership between consumers and policymakers. I should say here that it's very clearly aimed at policymakers and health service designers and planners to improve how they work with their community. So when you're reading it, if you're a consumer, you might think, oh, well, this doesn't really resonate with me. And I think that would be good to put that feedback back in the survey, but I think it's useful to remember that it's actually supposed to help the other side of the equation work with you. So it's always good to remember that. It's really aimed, the strategy, at building trust and strengthening partnerships, as I've said. It also says enhancing capability and capacity for policymakers to undertake effective, fit-for-purpose engagement with consumers and community organisations. So there's an acknowledgement there that many of the people in government, in policy roles, trying to develop new initiatives, new services, actually aren't particularly well equipped to undertake this work, and they need some capacity building and capability building. And it's also supposed to empower and facilitate consumers and community organisations to engage in and co-design preventive health policies and programs. I think part of that will be seen in how it actually gets implemented. I'm just going to share my screen just to go over some of the key issues that are the structure of the strategy as a bit of background for everybody. So if you've read it and you know all that, you don't have to look at that. Hopefully that is screen sharing now. Is it, Daniel? Yeah. So as you can see, the consumer engagement, there's three levels to this piece of work. There's the consumer engagement fundamentals, that consumer engagement should be purposeful. So it should have a shared understanding of purpose and outcomes. Objectives are clear and agreed, and consumers are engaged from the start and throughout. It needs to be inclusive. It needs to be respectful, valuing lived experience, particularly recognizing consumers as equals and experts, I think is one of the key parts. And perhaps the next one, dot point there too, is important. Consumers and organizations are resourced appropriately. And I think that would be one that we would all want to echo and amplify, that, you know, if you want consumers to engage and you want consumer organizations to engage, they've got to be resourced on an equal footing to be able to participate. Consumer engagement needs to be transparent. You need to have early framing and communication. You need two-way feedback loops, so you need to constantly be checking in throughout a consumer engagement. And as the policymaker, you need to be prepared to take a critique of what you're doing from consumers, which sometimes is not that easy, particularly if the consultation happens after quite a lot of the formative work has been done. And it needs to be collaborative. And I don't think anybody would have any problems with those fundamentals. I think we could all write those fundamentals and we can all agree on those. I don't think there's nothing new there, but it's good to have them, I think, all in one place, and to perhaps reflect on them when we do our engagement work. Think about whether we actually have stated the purpose, whether we are being respectful, whether we really are being inclusive. I think it's always good, you know, to have it up on your whiteboard, have it on your screensaver, have it wherever, to just think about these constantly. Then we have the good practice guidelines, which are here, and there's 10 of those. And again, there's nothing new in those. They're build and sustain relational, not transactional partnerships. And I think this is the critical one. You actually need to develop a relationship before you try to do something with people. Often you've got to have at least, not just jump in and say, I want to talk to you about X. Jump in, I want to talk to you about X, and jump out again. It's not going to work, really. Develop a detailed understanding of the context, identifying who to engage, and that's actually not as easy as it sounds sometimes. Seek and support diverse engagement, meet people where they are, so go to them, adapt your approach to meet the needs of consumers, not just physically where they are, but where they are in their headspace, where they are in their thinking on this particular issue is really important. Understand people require different approaches, so don't have a one-size-fits-all. Again, there's nothing that anybody, I think, would really take issue with here. Engage with humility and empathy. And I think this is where recognizing lived experience as valuable expertise, I think is really important. Actually, not just getting a consumer to tell the story for the sake of it, but actually listening to it and using it and acknowledging it, that it is an important part of the experience. So it's really important. Don't let perfect be the enemy of good. Well, that's true of almost everything, I think. Seek and act on feedback. So if you're asking for feedback, act on it, and then tell people what you've done with it. Too often, you know, you find that you don't do that. We go out, we ask people, we're guilty of it at CHF sometimes, of going out and asking people for their views, and then we don't show them the final report. Sometimes because we're not allowed to, sometimes because we just don't do it. And then monitoring engagement and evaluate impact. Always have that double loop learning so that you come back to, you've done it, you've thought about it, you've acted, you reflect back on it, and you see how you might do it differently. So seeing every consumer engagement process as a learning experience, I think, is one of the important parts of the good practice guidelines. And then the third part of the strategy was the help toolkit, which is, you know, a platform to a health engagement platform, a toolkit with basically some going through the key points again and giving people some practical advice about how they might do it. It's the same as many other toolkits. So that's the strategy in a nutshell. And I'm sure there'll be lots of questions later about that. And I hope that stopped sharing now. So to wrap up my time, I suppose I would say it's pretty much a strategy that you would never, there's nothing you can disagree with fundamentally. It would be what we would all think. I think its emphasis on building relationships is good. I think the critical issue is going to be in the implementation. And I think the other point I would make is that if you're going to build relationships and you're going to do this over time, then it is quite resource intensive. Those of us who've done much consumer engagement in the past know that, you know, it takes time, it takes resources, particularly if you're going to pay consumers for participating. And this is, for CHF, is one of the big issues, that often we'll get asked to do an engagement with consumers and then there's no budget for actually paying the consumers to participate. And so I suppose, I think, you know, for us, this is the key issue about building a relationship, building some expertise. Great if policymakers actually work through the toolkit and it gets embedded into the practice of, say, the Department of Health and Aged Care, that they all know it and all can follow the steps and can show you where, yes, we thought about who we had to engage with. Yes, we did that. Yes, we did that. Maybe it gives us all, consumers, a chance to also do a tick box when we're engaged, when somebody comes to us and engages us, and we can look at this guidelines and say, well, no, actually you didn't do that, or no, that wasn't so good, or that would be not good. So maybe we can use it as a way of judging how people engage with us as consumers. So I might leave it there, Daniel, and it's over to you, Anthony.
Thanks for that, Joe. Sorry, yeah. The chat's very active. I'm looking forward to the panel discussion once we're done. Anthony, over to you.
Look, thank you so much, Daniel, and thanks for that great introduction and overview of the draft strategy document, Joe. For people who don't know me, I'm Anthony Brown. I'm the Executive Director of Health Consumers New South Wales, and we're based on, and I'm coming from Gadigal land in the Eora Nation in Sydney. I suppose my reaction to this document is very similar to what Joe was saying, that it's great to see the Commonwealth interest in the area of consumer engagement, and great to see the bringing together of these fantastic ideas, and that emphasis on relationships and the importance of relationships is, as we all know, key. One of the things that I will say, though, that Joe's absolutely right. In the document that we have, for those of us who've been working in this area for a long time, it's not telling us anything new. It's great to see all of that information restated, but I'd actually suggest that what we have here is a list of great ideas and a great understanding of engagement, why it's important, how to do it, but we don't have a strategy. We don't have something that's committing some time, some resources, and people to certain outcomes. In New South Wales, by way of example, New South Wales has gone through a fantastic process, the New South Wales Government and New South Wales Health, of creating guidelines around consumer engagement. And what they've developed is a fantastic plan, a fantastic set of guidelines that's called All of Us. I'm going to put a link in the chat and encourage people to have a look at that. All of Us is all of those things that Joe's already mentioned. It's brought together fact sheets, it's brought together guidelines, it's brought together ideas about the key priorities for engagement. It's fantastic. At Health Consumers New South Wales, we contributed, we're using it, we're promoting it. But it's a fantastic tool, but it's not a strategy that's committing New South Wales Health to anything in particular. And what I think we really need, and we know that with engagement, we are all working with not a lot of resources. So yes, we need more resources, but we need a commitment that those resources are going to be dedicated to building the skills of those policy teams who we know sort of need help around this. So we need sort of commitments to things that are tangible, like training, that people will be given training to build their capacity and capability. Looking at maybe bringing in engagement specialists, people who have expertise in building consumer and community engagement, and those people will be part of the policy teams. And also looking at sort of clear and defined strategies about how we bring people with lived experience into these roles as advisors, whether it's setting up advisory committees, whether it's involvement in policy development, but clear commitments to these processes. So I don't want to give the suggestion that we don't need these toolkits. We do, but there are so many really, really good toolkits out there. I think what we need is a commitment to how do we bring those ideas and those great strategies into government's everyday practice. And yeah, looking for things that actually commit to, so that we know at the end of 1 year, the end of 3 years, these things will have happened that will build to this. What I'm going to do is actually, I want to let people know about some of the great things that are out there. I'm going to put in the chat when I finish talking some of the great work that both Health Consumers New South Wales has done, and I know that other people and other organisations on the call have done. I think it's really useful to sort of try and bring together some of those statements and things so that I think we can show that I honestly think we have enough toolkits. We need commitment to bringing that great knowledge in those toolkits to action. So I'm happy to take any questions, but Daniel, if you want to move on to Sophia, then happy to take questions now or at the end, whatever you want to do best.
Well, why don't we have Sophia present on behalf of CODA, and then we can move on to the panel discussion.
Yeah, thank you. Thanks for the opportunity to chat to you today. And I feel a bit like I'm talking to a group of converted people, I think, here. So I'm Sophia Petrov. I'm CODA Australia's National Manager of Policy and Engagement. I'm currently on the lands of the Wurundjeri people of the Kulin Nation and wish to pay respects to Elders past, present and emerging, and to any First Nations people who are here today. So for those of you who don't know us, CODA Australia is the peak body representing almost 9 million Australians over the age of 50. And for 70 years, our systemic advocacy has been improving the diverse lives of older people in policy areas such as health, retirement incomes, and much more. And our broad agenda is focused on tackling ageism, respecting diversity, and the empowerment of older people to live a full life. So, yeah, I've been asked to talk to you about CODA's take on the document, and I'm going to draw on my current experience at CODA and also think about a previous life that I had in local government with some reflections and then asking a few questions. So before coming to work for CODA, I spent a long time working in local government where I was responsible for community development and leading the organisation in embedding principles of community development into the practices of council. And when all of this happens well, we have really engaged communities that feel some sense of control over their lives and a choice in the way that they live and communities thrive. And I mention this for two reasons, because in my worldview, it's important to recognise the power and positive attributes of the people and the fact it is about people. And I was really pleased in this strategy to see that that's recognised in I think it was on page 30. And because what I see in this document as well is an attempt to put the fundamentals of community development principles into action in a practical way, and that's that connection with engagement. So those the focus on people, with about talking about people as creative, the experts in their own lives, and that policy should be designed by people with relevant lived experience is absolutely central. We often see decision makers making assumptions about the people that they're meant to be working with, and we see this all the time at CODA, assumptions about the capacity and capability of older people. So you see this through benevolent ageism, paternalistic attitudes, and blatant age discrimination, I would say. So it's if this strategy can get additionally to elevate those elements for people, that's a good thing that will come out of it. I love what the strategy has to say, but I want to see how it's going to be implemented in practice, and then how it will be measured. How can we test that co-design principles that are at the centre in this strategy are actually working? And so, I think there's some measurements that we probably need to have in place to actually understand that it is being implemented. also really pleased to see the focus on capability and capacity of policymakers, because I think as Anthony said, I think that is I don't want to say a deficit. It's something that often policymakers don't think about in terms of engagement, and it's also there'll be a shifting of mindset for many people. What we see often in policy, I'll say it's either an intellectual pursuit or mental gymnastics. And whilst lots of people are well-meaning, there's little connection with lived experience of people impacted by the policies being made. So there's a question, how do you unlearn a lifetime of behaviour, and what needs to be put in place to build capacity? What's going to be effective? What are the practical things that need to happen for policymakers to, well, they may not be the engagement experts, but to actually open themselves up to a different way of thinking about the way that they work. So I think the structure of the strategy is practical, and the consumer fundamentals that are outlined are solid. I think from my perspective, purpose is often the biggest hurdle in engagement, and this often couples with transparency. So in CODA's experience, in our framework, we've linked purpose and transparency quite closely, and we often ask the question of ourselves, what's the expectation and what's the promise? And I think we have to be honest here. And so for me, the transparency element needs to be elevated around honesty, because in that engagement, you actually have to be honest with people about what you're expecting and what you want out of them and what they can expect from you in the whole process. I was actually quite enamoured with the guideline around engage with humility and empathy, because I think this is where the mind shift needs to happen, that people need to be open, and I might say open their hearts. It sounds probably a bit soft, but I think you do need to open yourself to be able to listen to people's stories and actually engage yourself with those stories and see how is this going to impact on my decision making. So often we see that organisations think about their business first rather than turning this around to say putting the people first and then thinking about, okay, what does this mean for our organisation? So I see that's that flip about listening and engaging with humility and empathy. Another highlight for me was the guidance on seeking and acting on feedback. I keep talking here at CODA about, feedback is just feedback, and it's only unless you do something with it. So there are consequences if you act on the feedback, and there are consequences if you don't. And so I guess it's a key thing around being transparency is that you're actually honest about what you're going to do with the feedback and what you promise to do with that, and how what role is it going to play into future policy making. So the fact sheets are great. I was looking at them thinking, I might use some of these in my practice. But one of the things that was missing for me as part of the toolkit is guidance on what approaches might be beneficial. So as I think Anthony said, there are lots of different toolkits, and the references in the back of the strategy reference that. I think there are some toolkits that have some really good practical elements about the pros and cons of certain approaches that this toolkit could have benefited from. So whilst it might be situation specific, some basic guidance would be helpful. So, but we don't want to play into stereotypes. For example, in our case, we know that we have a large group of older people who want to engage online, and they absolutely love surveys, so that's what they've told us. However, they're also very wary of interacting with government online. So there's nuance in some of the approaches that we take. So one final observation about the actually strategy, the policy cycle and emphasising the role of people in each step is really great. And I think, how do we make that much more prominent in the whole discussion to show policymakers, yeah, this is what you're doing, but people have a role at every single step of the way. I think it was a good way of illustrating that approach. So as with all strategies, the challenge is implementation. We see many excellent strategies developed that languish due to lack of funding, interest, emphasis, and the challenge for government and policy and decision makers is to adopt a different way of doing things. It's hard. And the reason I went back to that way of community development at the beginning, because it is about giving up some of your power and giving up power and control and trusting people in the process. And as decision makers, even ourselves, giving up power is really, really hard, because particularly if you're seen as the technical expert or the custodian. So I would love to see this in action. I think, at the moment, it doesn't commit anybody to anything and to any action. It's a great guideline, but, how could we make this part of the Department of Health and Aged Care's corporate plan, and it's embedded into the way that they do business? So I think I'll leave it at that, and happy to discuss further or answer any questions.
Thanks for that, Sophia. And thanks, Joe, and thanks, Anthony, for those insights. We'll open up to the panel discussion now. The chat has been quite active, and there's a few questions in the Q&A, so we'll go through those. I've just noticed a few people have been asking for copies of the strategy. I'm just about to put a link to the Department of Health and Aged Care's consultation portal page for the strategy into the chat. Now, that has a link to both a PDF copy of the strategy and also the feedback survey that DOHAC have up there. So it will be available for everyone to both read and provide feedback to. So just one second. There we go, that's in there now. So I'll start us off with a question from Ricky Spencer, which came through early on, asking whether or not, as a fundamental aspect of consumer engagement, should it also have an accessibility and an inclusion plan at the beginning of consultation processes? Is that part of the strategy, or should it be?
I think the strategy does try to cover off on that when it talks about meeting people in their place and making allowances and making arrangements that work for everybody. So whilst it doesn't actually call it an inclusion plan and doesn't have that explicitly, is probably something that it could be more explicit about, Ricky. I think it's I'm just trying to find it. I know I saw it. It's in the tips. It's in the good practice guidelines. Meet people where they are, understand people require different approaches, and seek and support diverse engagement participation. So I think those three good practice guidelines together would give you the beginnings of, well, you actually need an inclusion plan to be able to say that you've done that. So it probably could be a little more explicit about that upfront. Some of the things you need in place before you go into consumer engagement might be one way of looking at it.
Yeah, I think, Joe, also the principles, inclusive and respectful, are absolutely essential to say that, if your engagement is not inclusive of diversity or the needs of different people, physical, emotional, all those other needs, then it's not a particularly good engagement. So, and I think that respectful element as well. So the principles, I think, set it up in that way. However, you need to work harder then in terms of what are your actual tactics to actually implement an inclusive and respectful engagement.
I'd agree with all of those comments. I also think that yes, it's important to talk about being respectful and inclusive, but when you get down to the level of planning and sort of engaging with different groups, it is really important to have specific plans and specific connections and knowledge about working with those different populations. And again, I'd say that there is already a lot of really good work that's been done on this. There's fantastic work and plans that are and toolkits around engaging with Aboriginal communities, with engaging with people from CALD communities, people who are neurodiverse, the LGBTI plus communities, people with chronic illnesses, and on and on and on. And I'm sorry if I've left out important groups there. That information is out there to be learned and to be utilised. And I think what we really need to look at is how do we then resource and enable people who are doing work that's going to impact on those different groups? How do we resource making those things reality and turning them into both implementation plans and sort of real, genuine, diverse engagement on the ground?
Thanks. That's excellent. Another question from Anthony Sangster, who has inspired quite a good discussion in the chat here. He says, this draft strategy ignores the cultural influence of health officials and clinicians, and their behaviour can derail any policy. How should this be allowed for within the strategy?
That's a good question. I think, first of all, I think it's worth remembering that this is actually being developed for preventive health. And while some of the guidelines and the fundamentals can convert over, so maybe not. But yeah, this is about all change management. All change requires cultural shift. And so you've got to really work. I mean, I think you've got to really work at getting everybody involved to see that they all need to move their positions. The other part of this also is to, if you like, Anthony, maybe address the imbalance between the consumer and the clinician by ensuring that your consumers are trained, that your consumers have enhanced capability. This is one of the reasons why I know Anthony's organisation spends a lot of time and effort training consumers to be, in how to advocate and how to engage and what to do, and why CHF sought money in the last budget but were unsuccessful to get a consumer leadership academy up and running, which would have been designed to enhance consumer capacity, so consumers were able to meet people, were able to meet with clinicians and policymakers and health executives on an equal footing. One of the things that we try to do at CHF, and it's not in this document as much as it could be, and I think that is a problem, is actually, it touches on it, but is actually getting clinicians and others to see the value of lived experience. It's in here partly, but we often say, oh, well, the only reason why would we have a consumer? All they'll do is tell their story. We have people say that to us all the time, and it's much more than that. It's about how that lived experience then can help and be used by everybody who's trying to make health services better, actually used to enhance what they're doing. And if you have so you've got to work at the power imbalance as well as the cultural shift. And I guess by doing it, I guess I'm a believer in that once you've got this and you've got a commitment to engage, then you can start to have some champions amongst your clinicians and things, and they can work with others to get to bring everybody along. It's a hard road to break that down, but I think it can be done.
Thank you, Jo, for the plug for Health Consumers New South Wales training. I've shamelessly put a link to that training in the chat, but I will also say that all the state and territory consumer peaks also offer training and support. And yes, training and building people's capacity is one way to do this, and also the training and building people's capacity for the health workers. I think a strategy can't do much more than just name the issue and name the power imbalance, and the culture needs to change. And as Joe says, it really needs to be demonstrated. The idea of champions and highlighting people who are doing it well, it is important. But I also think for it to be successful, we know that this needs committed leadership, and it needs, in organisations where engagement, has moved from tokenism to actually achieving things. It needs leaders who really believe that this can and should happen. And I think we need to look for those leaders and praise them and give them opportunities to talk to consumers and be involved. But again, the strategy can't do much more than just say those things. But I think we all have a role in sort of trying to highlight it, praise the leadership where it does well, and identify those champions.
And I think I've had my 5 cents worth. I asked the question before about, how do we undo years of certain thinking? This is part of that, and I don't think the strategy can do that either. But I think, is there, beyond the strategy, thinking around linking engagement and how engagement can bring benefits to other business practices, etc. So where you see people having aha moments and thinking, oh my goodness, I never saw that way, and suddenly people thinking about things, doing things in a different way. I can give examples from local government that probably don't sit quite well with this context, but I think we have, when there is genuine respect for the lived experience and what people bring, suddenly those who want to see it as an asset will find other things to learn from, in that it's not just a story, it's actually a whole experience of how the interaction, the journey, however you want to make it, so we can link all of those things. But it's not, I don't think it's the job of the strategy, but we do need to think about it and talk about it and challenge that long culture and those learned behaviours.
Excellent, thanks. So Kim Henshaw has asked, is there a parallel strategy to educate clinicians early in their career about respect and valuing lived experience experts? Is anyone aware of?
Well, we try. That's all I can say to that. This is a real battle. In the I don't know whether any of you remember the medical benefits review, which had a whole range, which was a long and drawn out process in about 2018. And they had committees made up of clinicians, and they had a consumer on each committee. And it was a very unsatisfactory experience for the consumers because they felt they weren't being listened to. And they ended up setting up a network of the consumers on those committees, talking to each other. And they actually put in a report in 2018 about how they could have done better to engage consumers. And a large part of that report was that they felt that the chairs of each of the clinical committees should have been given a how to use lived experience 101, if you like, that they had no idea why they had a consumer in their group. They didn't see any value. They weren't able to use it. They weren't able to encourage it in others. And so, it is about getting them, and they were obviously clinicians down the track. One discussion we had with medical students is that they might hear about it in the curriculum and be trained about it. Then as soon as they leave university and go into practice, the world changes. and no, we don't do that because we're doing this. So I think we could do one. So we could sort of try to do both, but it's something we're plugging away at. Anthony or Sophia might have another comment on that.
I'll just say that not a strategy as such, but in our advocacy, particularly in the aged care space, we look at the training of medical professionals and workers and their in terms of customer or consumer centric practice, which is missing. But I think, Joe, I've seen some programs in various areas with medical students actually in their second year of rotation, in their community placements, actually getting a full-on community experience, which helps them think about, okay, this particularly in, say, in home care, in working with potentially with an ACAT or others, to help them open their eyes to a different world. Because let's face it, in many medical professions, young people who've come from quite privileged backgrounds. They don't have a lot of experience with different people. I think the more that we can help them in their education, open their eyes, is really important. But I think, Joe, then there's this cultural thing after when they finish and when they move on. So we can keep highlighting some of the challenges, but I think it's important to do that. Yeah.
No, I completely agree, and I think one of the challenges is a lot of this work is something that happens at the level of training. And so we've been doing a little bit of work trying to get ideas of engagement into university curriculum, but it's hard and it sort of feels like it's subject by subject and university by university. So, and I know some people have managed to get some of this into some curriculum and some training. It's one of those things that I think we need to keep working at, and maybe not in this strategy, but maybe there's some training strategies or other strategies where we can, work hard to get engagement included in policy level at a state or federal level.
I will just add, we did some work with the Royal Australasian College of Surgeons about this, giving some talks with some students about how to talk to consumers, basically, which is truly extraordinary. But there we go. And there's quite a deal of resistance to sort of having consumers tell doctors what to do. They don't like it. So we have to keep trying. But we did do, the surgeons were actually quite interested in doing more in that area of actually taking lived experience. When you have to talk to a patient about having a terminal illness, for a terminal disease, or that a surgery is going to be very difficult and the risks and everything, having somebody tell you how that message is received can be quite beneficial. So their interest was on that level rather than having people tell them anything about how the system was built. But there are pockets of people. And the Royal Australian College of Physicians has a very robust consumer advisory group that is was actually developed by Health Issues Centre in Victoria for them, and they have a really good consumer advisory group informing the college. So I think there are some areas that are doing it better than others.
Mm-hmm.
And I also think just as the national standards started to change how health services think about consumer engagement, and when the national standards 10 or 15 years ago said you have to include consumers in the design and delivery of services, that things started to change there. I think we've started to see some change with universities and their training, because there's an expectation now that consumers will be involved in research design. So I think that will start to influence curriculum. So I think we need to look for these levers and accreditations that may not always be in these sort of policies, and look at how we leverage those as well.
Might just answer John Stubbs's question in the chat. The answer probably is no, John. Was there anything new learned from the engagement process that really needs to be highlighted? No, I don't think there was. Not for us anyway, because a lot of what came back to us from community conversations and conversations with consumer organizations and other community organizations was, most of this we already would have expected. I don't think there was anything unexpected in this. I think the depth of feeling about the need to be treated as an equal and to be involved in the process from the beginning to the end, and probably about acknowledgement of the value of lived experience. I think there was a stronger feeling about that than maybe people were expecting, and certainly the closing the feedback loop. People saw that as something that we really needed to do more about.
Following up on the discussion just before, Anthony Sangster has asked, do the colleges actually change their policy on the basis of lived experience input?
Interesting that you ask that. I know we've one of the colleges has reached out to us to talk about lived experience of older people and in accident and emergency, and I think they're opening up. And I think there was another question about, where do you see consumer experience, lived experience in 5 years' time? I think this is growing. We've got this growing movement. We've got people who are much more empowered. I think about the young people that, whilst representing older people, the young people that I work with in the past, who are much more articulate about health, about mental health, etc. So you do see. I think we are changing, and people they will have to listen. I mean, the expectation, if you look at what medical professionals training was some time ago, they have the fact that doctors are having to do interview, or future doctors are having to do interviews to get into their courses now, is a shift. So we do. It's still small changes, but I think there are changes, and I'm very, very hopeful that the power of lived experience will continue to grow and influence. And in 5 years' time, I hope the sky's the limit, but maybe I'm being too hopeful in that.
Well, I'd agree. I think we are seeing some changes, and like all of these changes, they're slow and they're patchy. There's some colleges that they've been mentioned, and the College of Physicians is I suppose a highlight, who have done a lot. Some who haven't done anything, and some who are just starting to dip their toe in the water. Some change in some areas, but it's slow, but it is happening. Not quickly enough, but it is happening.
A question for Anthony from Roger Hewitt. Anthony Brown seemed to say that the DOHAC strategy is not really a strategy. I felt he implied his view is based on it lacking plans and resources. Is that the case? Are there examples of better strategies?
So yes, I did feel it lacked. I thought it, from my reading of it, it brought together a lot of really good information about how we can do engagement, the things that are important to consumers, and all the things we've talked about. But I did feel it lacked sort of a commitment to resourcing engagement. I couldn't really see any plans or sort of commitment to the actual things that were going to happen on the ground, particularly because it is around health promotion and the development of health promotion work over the next few years. Would have really liked to have seen some commitments to what is going to happen in a few years' time. That how will we know that consumers have been involved in that process? So I would have liked to have seen, I suppose, some more clear commitments and outcomes. This listing of what people want and how we get there and how we do consumer engagement on a day-to-day level and how it's effective is fantastic. But I just felt it needed some more sort of milestones and sort of outcomes and things that they'd like to sort of see achieved and commit to resource, over the next few years. I don't know what other people on the panel think about that, if I'm a lone voice there, but
No, Anthony, I think I mentioned measures. How do we measure that it's actually effective? And so,
yeah.
in terms of a strategy, yeah, it needs some measures to actually measure whether it's been effective.
I would agree with you, Anthony. I don't think it should be called a strategy. I think if you look at why it's sort of setting the scope of the work which we were involved in doing was to come up with a resource. So actually the scope of the work was not to actually have a strategy. And I think strategy is the wrong word for it. I agree with you. Because a strategy would say, we want to do consumer engagement. This is why we want to do it. This is the environment we're going to create to allow it to happen, not the nuts and bolts of how you're going to do it. So I would agree with you that I don't think this is a strategy.
Yeah.
I think this is a toolkit.
And it's got the guts of a really good toolkit and a really good resource. There's everything that's in there is fantastic, but it's how do we bring it all together and actually do something? Yeah.
Okay, well, it is 2:57. I think that's probably the end of the time that we have for questions. I would like to personally thank Joe, Sophia, and Anthony for the time that they've put on this. And I'd like to thank everyone in the audience for coming along and taking part, especially those who had questions for the panelists. I've put the link to the strategy and the survey page from the department in the chat. I'll put that in there again, and I'll make sure it's uploaded when we upload the webinar. The survey from the department is open until the 4th of September. So if you've come away from this with thoughts that you think you might like to put to the department, the survey there is how you do that. So again, thanks everyone for coming along. We will see you next time.
Okay. Thanks everyone.
Bye.
Bye.